So these are just some of the musings of, why I think sometimes hair transplants look very poor. There's 6,001 other reasons that are very technical and intricate outside the scope of this video, but we can go into that some other time. But these are the main reasons why I think sometimes hair transplants look really bad. So number one, very poor planning. It's important to make sure we understand the patient's existing native graft density and donor graft density. And then we want to think about the trajectory of their hair loss and how things are going to look, not just 1 year after surgery, but extrapolate that 3 years, 5 years, 7 years. And only then will we have a good idea of what the actual results will be. Number two, poor technique or inexperienced staff. I think hair transplant surgery is often used as the middle child in many surgical procedures. It's often outsourced to contractors, and often physicians aren't even part of the surgery whatsoever. The way we perform surgery is certainly an art, comes over many, many years. There needs to be passion to the artistic design. It's like riding a bike. And I think so many times a lot of patients are just left with contractors who fly in, fly out. The surgeons don't even have their own staff. So I think it's very important to ask these questions. How long have your nurses been there for? How long have your technicians been there for? How many surgeries do you actually perform a week? And how much of this work does the physician actually do? Who anesthetizes the scalp, etc., etc. So do make sure you ask these questions when you first consult with the clinic you're thinking of going to. Number three, post-surgical planning in terms of graft distribution. What that means is sometimes we see very, very dense hairlines with very sparse density behind there. Or sometimes there's been a big mismatch in terms of how much density the patient actually needs, and just to keep them happy, the clinic has agreed to do 1,500 grafts and cover the entirety of the scalp. That's almost like using one can of paint to paint an entire house. It's not going to work. We have a fixed amount of ingredients, and obviously the area of supply is fixed. So it's important to sort of understand this play and be very, very realistic. If they need more than one surgery, then you need more than one surgery. But it's important to explain this at the very forefront of the consultation. And finally, I think there are very, very poor outcomes in hair transplant surgery because the time and dedication to this niche speciality is not afforded on part of the medical clinic or the patients in terms of aftercare. I always tell patients this is not a walk in the park. You will be, disheveled in your appearance for roughly 7 to 10 days. There's lots of homework to do for the next week. And I get really tired of clinics telling patients, oh, it's a 3-day procedure in and out and it's fine. Well, actually it's not. My job isn't to tell you simply what you want to hear to do the surgery. My job is to ensure that the outcomes are excellent so that when my work walks around, I'm proud of it and you're proud of it. And if that means there's some homework and downtime for 7 to 14 days, so be it. Things that work very, very well in life require some hard work and grit, and this specialty is no different.